managers and social workers and all of that that need to know that. So that's why we set up this training, so that those of you who are working the most closely with families know how to prepare them, know how to guide them along this medical redetermination that is starting to happen across our state. So for those of you here at the Park District, welcome. If you need bathroom facilities, they are past the front desk on the right-hand side. If you're online, just take care of that by yourself. I'm going to introduce and invite Eva from the Federation to unmute herself and talk a little bit about how our interpretation rooms are going to go.
Good morning. Thank you. I'm Eva Rafash. I am the Senior Program Director for LARC, the Language Access Resource Center, which is a program of the Federation. And I am inviting our interpreters, Luis, who is going to be assisting with Spanish, and Tuan, who is going to be assisting with Vietnamese.
Hola, buenos días, soy Eva Rafash, soy la coordinadora del DuPage Federation. Estoy invitando a Luis, que va a hacer la interpretación en español, y Tuan, que va a hacer la interpretación en Vietnam.
Ok, tôi là Eva, tôi là những người làm thông dịch viên cho những người Việt ở đây. Tôi là những người trong liên bang về cái chương trình về giúp trẻ con ở đây. Có kịp nghe hay không?
Wonderful. With this, I am going to share my screen so we can provide you instructions how to access the interpretation in a separate sound channel.
Entonces, maravilloso. Voy a compartir mi pantalla porque les vamos a compartir las instrucciones de cómo ustedes van a poder acceder a la interpretación en diferente canal de audio.
Chúng tôi sẽ chỉ những người mà Việt Nam vô để làm sao mà nghe được tiếng Việt vô trong cái laptop và cái desktop và computer ở đây để anh chị có thể nghe được thông dụng bằng tiếng Việt.
Please refer to the slide that is shared how to access the interpretation channel in Zoom.
Por favor, refiérese a la pantalla que estamos compartiendo de cómo se puede ingresarse en la interpretación en Zoom.
Rất là nhiều về phía computer, trong này nó về tiếng Việt thì bấm một nút đó để làm sao để dùng được nghe được thông tin Việt được bằng tiếng Việt.
We are going to be utilizing the separate sound channels for the interpretation. And as soon as we are done with this introduction, you are going to be seeing a little globe sign show up at the bottom of your Zoom screen.
Vamos a usar diferente canal de audio para la interpretación. Una vez que hayamos hecho la introducción, ustedes van a ver el globo terráqueo, el icono abajo en la pantalla inferior.
Thì anh chị muốn đi thông dịch Việt, coi như là cái màn hình nó có cái chữ thông dịch, anh chị bấm vào chỗ đó, như có cái xoáy anh chị nhìn vào chỗ đó mà bấm để nghe tiếng Việt.
If you are accessing this meeting from a laptop or a desktop computer, the globe sign is going to be in that toolbar at the very bottom.
Si ustedes están usando una computadora portátil o una computadora de escritorio, ustedes van a ver el icono en la parte inferior de la pantalla.
Nếu mà quý vị dùng laptop hay là desktop computer thì nhìn ở phía dưới có cái toolbox thì bấm vào cái đó.
Once you click on that interpretation sign, you are going to have a other box popping up, and there you can pick the language.
Una vez que hayan escogido este icono, ustedes van a ver otro menú que sale. Y allí va a haber una casilla y allí pueden ustedes elegir el idioma.
Sau khi anh chị bấm vào cái chỗ mà nó để interpretation xong rồi bấm vào trong đó nó sẽ hiện ra cái chương trình Việt Nam, thì anh chị bấm vào cái đó thì sẽ nghe được thông tin bằng tiếng Việt.
You will be able to see the button Spanish, And for some technical difficulty, the Vietnamese button is not working, so I am going to utilize the French button instead. I do apologize for the missing correct language name, but the French button is going to be utilized for Vietnamese.
Ustedes van a ver el español, un botón de español, pero disculpe que no está el idioma del Vietnam, entonces vamos a utilizar el botón de francés, mil disculpas, pero ustedes van a poder acceder a este idioma a través del canal el francés.
Khi mà bấm vô cái chỗ mà thông dịch đó thì chữ mế hiện nó có sẵn rồi, nhưng mà xui cái là tiếng Việt đó làm về kỹ thuật đó, nó không có hiện ra, thì hay vì bấm vào không có tiếng Việt thì quý vị bấm vào chữ Fan, tức là tiếng Pháp á, thì bấm vô đó thì nó sẽ là thông dịch tiếng Việt.
I also would like to note that we have arranged for Arabic interpretation as well, but unfortunately, the Arabic interpreter fell sick last night, and we have not been able to find an interpreter to replace them this morning. So unfortunately, we do not have Arabic interpretation available at the moment.
También quisiera dejarles saber que desafortunadamente no podemos tener interpretación en árabe. La intérprete de árabe se puso enferma anoche y no hemos podido encontrar un intérprete de árabe, desafortunadamente.
Chúng tôi có làm về tiếng thông dịch về Ả Rập Arabic, nhưng mà xui một cái người thông dịch viên bị đau ốm tối hôm qua, không tìm người thay thế kịp. Xin quý vị thông cảm dùng cái chuyện đó.
And let's see the second slide, and we are almost done. How to access the service from a smartphone or a tablet.
Ahora, la segunda dispositiva, ustedes van a ver, casi hemos terminado, cómo se puede acceder al canal a través de una tableta, un teléfono inteligente.
Bây giờ nếu những người quý vị mà có smartphone hay là iPad đó, thì chỗ này sẽ chỉ cách sử dụng như thế nào để nghe được thông dịch.
Please look for at the bottom of your Zoom screen of your mobile device for the three little dots or the word more. It is going to offer you the interpretation as the second picture shows.
Por favor, busque abajo en la parte inferior de su pantalla en su dispositivo móvil tres puntitos o el menú donde dice more, más.
Nếu mà nhìn vô cái phone hay là iPad đó, thì sẽ thấy cái ba cái chấm đó, thì bấm vào trong đó nó sẽ hiện ra để thông dịch, nó sẽ hiện ra chỗ thông dịch, thì quý vị bấm vào cái đó.
Once you located the little globe sign, please click on this prompt, pick the language. You may mute the original audio if you wish to listen to the English, but in a quiet one, you do not have to do that, and then finish up your action with clicking done.
Entonces, una vez que hayan localizado su idioma, entonces tache la casilla del idioma preferido. Pueden también silenciar el audio original si no quieren escuchar en inglés, pero no tienen que hacer eso. Una vez que hayan terminado, terminen la acción empujando el botón donde dice done.
Sau khi quý vị bấm vào đó thì quý vị sẽ thấy một cái chữ mute đó, thì quý vị nếu không muốn nghe tiếng Anh thì bấm vào cái đó thì sẽ không nghe tiếng Anh, chỉ nghe tiếng Việt thôi. Nhưng mà bấm chữ done tức là xong rồi.
Thank you. And with this, I am opening up the interpreter channels. Please locate those little globe signs on your device and you may join the room. Please remember, Spanish is for Spanish and Vietnamese is going to be appearing as French at the moment.
Okay.
Thank you, Ava and Luis and Tuan for providing this service. We really appreciate it. We'll let folks get to their rooms as we continue. Are we good to go, Ava?
Yes,
right.
we are.
Awesome. Awesome. Well, then we will, I want to do one more introduction, actually, too, for those, and you're going to need to come here so our friends online can see you too. I want to introduce my colleagues, Kara Murphy and Dave Roth. Do you want to say a little hello and what your deal is?
Sure. Hi, everybody. Kara Murphy with the DuPage Health Coalition. Really happy to be here today. Sorry that I'm masked up, just getting over a little cold. But primarily I'm here to talk a little bit about those folks who might lose coverage through the process of redetermination, not because they are not able to navigate the process, but because they sincerely don't qualify after they're reassessed. We operate the program Access to Page, as well as a program called Silver Access, which helps people to purchase the ACA coverage for which they qualify. So more about that later. Thanks so much. Happy to be here.
If I may interrupt for a moment, I would have a respectful request towards all our speakers, including all presenters. Please keep in mind that our interpreters are working hard in those other channels. Don't speak too fast if it is possible at all. Please keep a nice, even pace. It is really going to help their work. Thank you.
Thanks, Ava. We want to keep a nice, even pace as we speak so that everybody can the conversation and hear what's presented. I'm Dave Roth with DuPage Redetermination, and it's my pleasure to introduce Margaret Dunn of the Redetermination Division in the Illinois Department of Healthcare and Family Services. Has been a tireless champion in planning, training, and preparing us for this change, for this redetermination process starting again. The floor is yours. Thank you.
Okay, thank you very much for the introduction, and hello to everybody that's attending today. I am going to share my screen. Okay, and let me get it to the biggest size in a minute here. I'm always waiting for that bar to go away on the top. There we go. Okay. Today we are talking about, as David said, the end of continuous coverage, also called the PHE unwinding, and the beginning of redeterminations again, or the restart of redeterminations. This is just a little slide on HFS, what our values and our goals are. We do value our staff as an asset. We're always trying to improve, and we always strive to inspire public confidence. Here's a little bit about what we're going to be talking about today. We will review the end of continuous coverage, the beginning of or resuming medical redeterminations. We'll talk a little bit about special populations and also about our communication strategy. In the second part, we will talk about outreach efforts, both with our partners, with outreach events like this one, and also talk a little bit about Manage My Case. Now, to give a little bit of background on what got us into this position. As we all know, COVID-19 happened several years ago now. It's hard to believe it's been 3 years since this public health emergency was declared back in 2020. So what that meant is the federal government gave states the right to have continuous coverage or continuous enrollment as a part of this public health emergency. And on December 29th of 2022, there was a Consolidated Appropriations Act. And what that did was separate the end of the PHE with continuous coverage. And what that meant for us in Illinois was that the continuous coverage period would end March 31st, which has gone by. So that period has ended. We did begin the redetermination process on April 1st, although customers didn't see that part. That's us working on our end to get ready to send things out. The first group of redetermination letters will be going out around May 1st, and potentially customers could lose coverage on July 1st for our first group. I also wanted to talk a little bit about the flexibilities that we will continue to have during this unwinding period. We will continue to accept attestations from the customer for income, incurred medical expenses, and insurance status if we cannot prove that with our interfaces we have with other state agencies. We will accept the information the customer is telling us. Of course, when the caseworker reviews the case and determines eligibility, the caseworker would be looking at other records, and if they can't find proof, they would request proof from the customer. So again, that's something that we've been doing throughout the PHE period, and we'll continue with that for new applications during this 1-year unwinding period. Also important to note that we will be delaying any changes of eligibility until each person gets to their redetermination date, which will not be on May 1st for everyone. It will be spread over a 12-month period. We'll continue to have presumptive eligibility for Magi adults at initial application, meaning they will be, as soon as we register their application, they'll have coverage during the period where caseworkers determine eligibility for ongoing coverage. We've also increased the amount of times individuals can have that presumptive eligibility from 1 to 2 times during a calendar year. So now to move on to restarting redeterminations. Our goal at HFS is to minimize the number of eligible customers who lose coverage. As was stated earlier, we know that there will be some people, because of change in circumstances, who will no longer be eligible. But we want to make sure that those people that are eligible will continue to be covered. We don't want them to lose coverage because they don't get a redetermination packet, because they don't know how to complete it, because they don't know how to send it in. So we will provide all customers with access to multiple customer-centered redetermination, completion, and submission opportunities, because of course we want to ensure all Medicaid eligible customers continue to connect with their healthcare providers. So the most important thing as we move into this period is to know where to find those all-important renewal dates. For customers and for assisters, those dates can be found on aid.illinois.gov. When individuals register for Manage My Case, they can be found under the Benefit Details tab. For providers, that date can also be found in the Medi system. Managed care organizations will also have those dates. We are doing data sharing with those organizations so they can also assist the customer. So they will also be a source to find out that redetermination date. Also, very shortly, we will be automating a phone line. So customers will be able to call that line, give a little bit of information, and then receive that redetermination date. This is just a quick review for providers that will be using Medi. They can individually find those dates, and they can also do a batch inquiry. This won't mean a lot to the rest of the audience, so I'm gonna breeze past that, but just so providers know, we do have a process where they can receive those REDI dates for all the individuals in their practice. This is the individual Medi screen for providers if they are looking up REDI dates for individuals one by one. You can see in the bottom corner here, there is a renewal due date for this individual, April 1st. There's also a form that that individual will be receiving. We do want to note, however, that form number or that form letter will not be accurate until 1 month before the renewal date. So for providers looking at this date, it will only be accurate 1 month prior to the renewal due date. So talking about forms, that indicator had a form letter and we have Form A and Form B. Form A is also known as ex parte. Form A does not require customer action unless information on their redetermination has changed and is no longer accurate. So what that means is the letter will still go out to the customer, but unless something's changed, they will not need to send that paperwork back in. Currently, we had, or before the COVID period, we had about 30 to 40% of our medical customers that went through this ex parte or Form A process. Because we've added some new groups, we expect that percentage to be much higher. At least 50% of individuals will get that Form A. The rest of customers will get Form B, and those are for those individuals where we could not verify information. The redetermination paperwork they will get will be pre-populated from information we do have from their case records. The customers will have to review that information, update anything that's inaccurate, and fill in some information as well. It is very important to attach proof of income if you can for the last 30 days. That means that there will not have to be additional action taken by the customer at a later date. If we can't verify the information electronically, we will send out a request that the customer return that information to us. So best to just do it right off the bat. Then we don't have to send out that letter and delay the approval process. I did want to give a little visual of the Form A, and you can see right at the top, it says, based on the information we have, the person listed below will continue to get medical benefits. And it will say that they need to review the information and let us know of any changes. And you can see for this individual, their new coverage starts on July 1st because their previous coverage period ended on June 30th. Here's an example of the Form B, and please know that it is not just this one page. There will be several pages, but I just wanted to point out the difference between the Form A and the Form B. On Form B, it will say you must complete your redetermination to continue getting medical benefits after June 30th. You'll have to review and correct any information that's wrong. And it has also got a date on the letter. You must respond no later than June 1st in this example letter. And here is a timeline for customers of what will happen as we begin the redeterminations. For example, for those customers that currently have coverage that ends on June 30th, they will have a form mailed to them by May 1st. Their REDI due date will be June 1st, and we will have a cutoff date of June 15th. So we'll continue to accept those REDIs up to June 15th. And if it is not returned by that point, on July 1st, their coverage would end. If we don't receive that Form B, no coverage. However, we do have a 90-day reinstatement period. So if we do receive that information up through, in this case, September 30th, that individual would fall into this reinstatement period, which means their coverage would then get backdated to the first day of lost coverage. So as long as we get it by September 30th, their coverage would be backdated to that first day of lost coverage, July 1st. If we don't get it by that date, in order to resume coverage, an individual would have to submit a new application and go through the entire approval process again. And you can see for subsequent months, we follow the same process. The end of a certification period is always the last day of the month. The form is mailed out at the beginning of the month. It's due 1 month later, again at the beginning of the month. Halfway through the month is the cutoff date, And then the first day of the month after their certification period, they lose coverage. And again, we always have that 90-day reinstatement period. And I just again wanted to point out, this is just an example. We're not going to be sending out REDs just for these 3 months. It will be spread over a 12-month period from June 1st to May 1st of 2024. How can you complete the redeterminations? We think the easiest way is online through abe.illinois.gov, through Manage My Case. If a RED's due, a renew button will appear, letting you know that it's time. And once you click on that button, you'll be able to go through all the paperwork that you would receive in person, just online. And you'll be able to complete that, hit that submit button, and we'll know the date and time that it was turned in. Also, new this year is being able to do a medical redetermination over the phone. We've already started it with the SNAP program, but as of May 1st, we'll be doing it for medical as well. So there's a number to call. You will talk with a caseworker over the phone and give them the information, and your RED would be submitted. We do have the traditional method of turning in the paper renewal information, either to our central scanning office by fax or by mail to the address shown on the screen. Finally, the last way of submitting that redetermination would be to go to the local office and drop it off, or meet with a caseworker in the office to complete it. We see that as the least desirable because you would potentially have to go to an office which currently have some limited hours. You would have to probably wait for some time in the waiting room. So again, we see that as the least desirable, but it is certainly still an option for customers. I also have a link here on the bottom for certified application assistance. If you were to click on that link, put in your zip code, you would get a list of assisters that would be available to you in your area. And a little bit more information on the redetermination form. We often hear from providers or agencies, can you just give us a stack of REDs so that we have them here for customers? The reason we don't do that is because each individual redetermination form is coded. There's a barcode at the bottom, and that has case information on it. And it also has the number of the form. So each form we fill out or we send out is tied to a specific customer. So we don't want anybody copying ones that are sent out or having blank ones, because that will mess up our process. As long as the paper form is returned to the central scanning unit, it'll be scanned into our integrated eligibility system, IES for short. We use a lot of acronyms. And the case will automatically be updated to show that the form was received. So it'll have the exact date and time that the form was scanned into IES. And as long as we have that renewal date submitted by the due date, the case will stay open. Any future action will depend on the eligibility process once a caseworker reviews the information. Okay, now moving on to special populations. One population we've already begun with, we know that a large group of people, exactly 55,000 individuals, transitioned from ACA adults to AABD during the PHE period. So they changed age or they began receiving Medicare, but their coverage didn't change because we continued everything during that 3-year period. So in February of this year, for those 55,000 people that turned 65 or started receiving Medicare, we transitioned them from ACA adults to the AABD group or AABD MET spend down. meaning that their income was too high to qualify for AABD. However, we put them in the MET status. So we have them still covered, and they will stay covered until they get to the redetermination, at which time we would reevaluate whether they can remain covered. I did also want to point out that we have had an increase in income and resource standards in 2023. You can see on the screen for AABD medical, for one person, the amount has gone up to $1,215. For two people, it has gone up to $1,643. For our Medicare savings program, we ask you to look at the policy because that's a more complicated and not easy to enter in just one space. A big difference this year, which was decided by our state, was the income test went up quite a bit. In the past, it was only $2,000 for one person and $3,000 for a couple. That amount has gone up to $17,500. So quite a big jump. So individuals can have that much in assets and still be able to qualify for AABD. Now for the Medicare savings program, that amount went up as well to $9,090 for one person and $15,160 for two people. So this means that any pending applications, we would apply these new standards beginning with January of 2023. For those individuals whose coverage did change, we did want to point out a great resource in Illinois, the Senior Health Insurance Program. And it's actually not limited to just seniors, but also persons with disabilities and their caregivers. So they're a great source of information. They can assist with completing Medicare applications and Medicaid applications, as well as the Medicare Savings Program. So a great resource for individuals. We did also want to point out for those children that turn 19 anytime during that 3-year period.
Hey, Margaret, we lost our internet connection here in West Chicago. Can you hang on for a second, please?
Sure.
Thanks.
Sure, no problem. Just let me know when to start again.
Okay. Let me try it again, Margaret.
Sure, that actually gave me an opportunity to have some water. So that worked out for me too. And you know, one thing I do want to add is that I'm sure that my colleague, Lauren Polite, who is a policy analyst, has been busily answering questions in the chat or Q&A. So thank you, Lauren. It's always great to have her with us, and we are a great tag team. So moving on to speaking about children that have turned 19 sometime during the 3-year PHE period or during the unwinding year. For those children, we will be sending out a form in addition to the redetermination paperwork. That's the 643A, 19-year-old aging out of all kids medical benefits form. So a very appropriate title to that form. So it'll be included with the redetermination paperwork. The 19-year-old will need to complete that form and turn it in along with the redetermination paperwork. One thing I did want to point out, sometimes people are under the assumption that 19-year-olds will have their own case. That's not necessarily true. It is actually based on tax status. If the child will be continue to be claimed by their parents on tax documents, they'll remain on their parents' Medicaid case after turning 19, as long as they're still income eligible. If they will no longer be claimed by their parents, a new case will be established for the 19-year-old. That form must be completed, even if the teen will remain on parents' case, so that we have that information in our system. Parents cannot sign that form. It does have to be signed by the 19-year-old. Okay, I also did want to refer to the Get Covered Illinois site. For those individuals that may no longer qualify for Medicaid, the marketplace is an option for them. And Get Covered Illinois is a great resource to find out about the marketplace. They do have certified application counselors that can assist customers through this process. It can be a confusing process, so they are there to help. Those individuals can also help with Medicaid applications as well. They're trained on both. Now, I'll briefly talk about communication strategies, and the most important thing is to know that we have a website set up, medicaid.illinois.gov, where we will have up-to-date information and a lot of great resources. Right now, we are in phase 2, ready to renew. Phase 1 was all about getting addresses updated. Phase 2 is the redetermination or ready to renew period. This form, however, does still have a link to updating addresses because it's still important. We want to make sure we have correct addresses. This site also has Q&As. It has our Ready to Renew toolkit, which has some great materials, including palm cards, things that can be displayed in providers' offices, and a lot of other great tools for you. There is going to be a text messaging schedule. HFS, DHS, and MCOs will potentially be texting customers, and this has just got a timeline and what the messages will be. We'll start 75 days out from that due date, just letting them know they need to make sure their address is current. Then 60 days prior, we'll let them know that the renewal will be coming. 37 days prior, we'll let them know the notice is coming in 7 days, and on and on. We've got 25 days prior, 2 weeks prior, and finally 1 week prior to that due date. I also wanted to mention that some providers may also be doing a text messaging or email campaign as well. Here's an example of a message that a customer might get. Get ready to renew your Medicaid, find your due date, and verify your mailing address at abe.illinois.gov. We are trying to shepherd people to that Manage My Case tool because it's a great tool. And as you'll hear me say repeatedly, it is the easiest way to submit redeterminations. Our media campaign is going to be statewide. It's going to be targeted to our Medicaid population, omni-channel, meaning that we are going to use all channels possible, including social media, radio, and even TV advertisements. We will be launching this campaign throughout the year, and it will also be multilingual. In fact, our toolkits are available in 10 different languages. Moving on to talking about our outreach efforts. We have a great partnership with our MCOs, and they are taking a big part of this effort. We also have outreach events like this, and also finally talking about Manage My Case. Our MCOs are developing a robust outreach initiative, which is going to include those text messages I talked about, emails and mailings to members, phone banks, and customer engagement. For example, if a customer contacts their MCO and they actually have a renewal due at that time, the MCO will offer to transfer the call over to the DHS helpline, and the customer will be able to complete that over the phone right then. They're also going to be participating in redetermination events. They will have redetermination awareness campaigns. And lastly, I did want to point out that we are sharing information with the MCOs to help in this effort. So we're sharing those due dates, our timelines for customers, and letting them know when that 90-day reinstatement period ends, all to the purpose of keeping those customers enrolled and covered with medical coverage. We're also asking our providers to help us. We want providers to encourage customers to learn about their redetermination date. When providers are speaking with customers, to tell them when their redetermination is due. For instance, looking it up through the Medi system and letting that customer know what their RED due date is. And refer customers to Get Covered Illinois Navigators. Remember, I talked about Get Covered having individuals that know all about Medicaid as well as the marketplace. They can assist customers with their redetermination paperwork as well. Please also let customers know about the timeline about redeterminations. They're mailed a month in advance of the renewal date, 60 days before the end of their current certification period. Also encourage customers to make sure their contact information is up to date. They can do that through Manage My Case by calling the number listed on the screen, 877-805-5312, or by submitting the online form to update their address. Also, the gold standard, if you have the people and the time, would be to assist customers in setting up Manage My Case accounts. Again, the easiest way to submit redeterminations. Outreach events. We do at HFS have a speakers bureau now, so that we are offering to participate in community events and different activities like this that we're doing today. We do have a community event participation request form. The link is there. We do ask that requests are submitted 12 to 14 days prior to the date of the event. All submissions are reviewed by our HFS outreach team. We will try to participate as often as possible. I do at this point also want to let you know that we'll be having a 3-part series coming up, hosted by HFS through our WebExes, and it will give you additional information on this process, a review of all the forms that will be going out, and how to assist customers through the process. Now moving on to Manage My Case. This is Manage My Case Lite, I like to call it. We do have a whole half-hour presentation just on Manage My Case, but I'm just going to hit the high points today. I'd like to also say that this is kind of like my chart that people have through their providers. It's my chart for Medicaid. We call it also the 3 C's of Manage My Case. First, creating an account. Next, checking for that all-important renewal date, also for any notices that have come out over the last 12 months, also for any upcoming appointments. The customer also has the ability to change information, changing addresses, changing income, changing household members, adding or taking away, also reporting expenses, uploading documents, and submitting that renewal. By using Manage My Case, it allows the customer to make fewer visits to the local office, to stay informed on the status of their benefits, and to manage their case information. And again, we urge all agencies with customer contact and resources available to assist customers in setting up Manage My Case. Just a quick review of how that's done. Some customers already have a user ID and password if they submit an application through ABE. That would be the same information that will be used for Manage My Case. If they forgot that information or never submitted through ABE, no worries, they can set up that user ID and password now. In any case, once they set up set up that user ID and password, the second step would be linking their account. The image on the left is for individuals that have newly set up accounts. The screen on the right is for individuals that submitted applications through ABE. And you can see it actually has the application listed here and the current status, which right here is listed as submitted. But on both these screens, you would click the link your account or link your account button here. And the next screen would come up. You're simply adding the date of birth and then either a social security number or individual ID number. We've found that it works best if you enter one or the other, but not both. And I did want to point out that individual ID number is not the same thing as the RIN or recipient identification number. It's a 10-digit number. It's listed on the top right corner of a notice of decision letter. It's also on the last page of that letter. There is a third step after linking, which is identity verification. We do have a huge improvement right now in this process. We've added the Secretary of State as the first line of identity verification. We hope that this makes a big difference. And actually, we've already seen a difference in people requesting manual identity proofing because of the Secretary of State. So that is the first line of identity proofing, Secretary of State. For those that don't have an Illinois driver's license or state ID, we do still have the Experian process as a secondary method. And then finally, as a third method, if the Secretary of State or Experian don't work for the customer, and that's the manual identity proofing process. Here's what the Secretary of State process looks like. It'll simply ask if you have a driver's license or state ID. If you answer yes, you'll advance to the Secretary of State ID proofing screen. If you answer no, you'll advance to the Experian identity proofing process screen. And here is the Secretary of State screen. You're going to be entering information exactly as it appears on your driver's license or your state ID. Very important to enter it exactly, because if you don't, it will not be a match. So this is one time, you cannot lie about your weight. It has to be whatever is listed on your ID or driver's license. Also, I did want to note that middle name should not be entered unless it appears on the ID. If you're successful, it will take you to a thank you message. And then once you click next, you'll go to the Manage My Case landing page. If you are unsuccessful, you will pass to the Experian identity proofing process, which is a series of randomly generated questions that the customer should know. And it is based on tax information, ownership information, previous addresses, and things like that. If you're successful, the next button will take you to the Manage My Case landing page. If you're not successful, you'll get one more chance to go through identity proofing, and that would be through calling the Experian help desk phone number. If it's not successful, there'll be a hard stop at this point, and the customer will need to go through the manual process. If you are successful, you'll answer yes, and you will be able to proceed to that Manage My Case landing page. Here is a picture of the manual identity proofing process. You'd need to fill out the form and return it along with proof documents to the address on the screen. And you do need to allow 6 to 8 weeks to hear back from the state. Here's a list of the types of documents we need, either one document from column 1, or if the individual doesn't have any of those, they would need to submit 2 documents from column B. Okay, so now all those things have been completed. I do want to point out that application agents, assisters, and MCOs should not be creating Manage My Case accounts unless the customer is with them, unless they have been designated as an approved representative and have that signed approved representative form. Staff can assist, and again, we ask staff to assist whenever they can in helping the customer set up their Manage My Case account. They can help through the phone or through Zoom or in person with the customer, but the customer does need to sign any forms that are submitted through Manage My Case. Also important to point out that staff should never keep the customer's user ID and password. They can write it down and hand off to the customer to keep in a secure location, but they cannot keep that. That would present a risk to that private information, which is HIPAA protected. Finally, we ask if you are an application agent, in order to communicate with caseworkers, you do need to have the application agent customer authorization form signed by the customer. Finally, now that we've done all that, the customer would land on this Manage My Case landing page. You can see at the top, we've got 4 tabs: case summary, benefit details, contact information, and account management. Very important things are right on that first page. Here's that Renew My Benefits button I talked about that will display 30 days prior to a due date. There's also a Report My Changes button, which will get you to the page where you can change an address. Also, the Apply for Other Benefits, which allows customers to apply for SNAP or cash benefits if they would like to. There's also at the bottom here, click for details about their types of benefits. And here also is where they would arrive if they click on that benefit details tab. In either case, whether they click from the case summary page or that benefit details tab, they would see this screen which lists what benefits they're getting. And then they also have the ability to click on the writing in blue. And once they do, that will give them additional information, and it will give them that all important due date. So for this individual, we have listed that the redetermination must be completed by April 2023, and that would actually be April 1st, because remember, due dates are always the first of the month. There's also information on the medical page for the individual's MCO information. Now, if you would have clicked on the food assistance program details, you would see information about the monthly benefit for, I believe, 3 months. Here's that Report My Changes page. If you were to click on Report My Changes on the front page, you'd come to this page. I've got the all-important contact information highlighted here, which would allow the customer to change their address, their email, their phone number, also to add or cancel an approved representative. Once they click on that, an additional page would come up where they would enter that information, and then they'd have a submit button. If the individual clicks on that Renew My Benefits button, which again would only be there 30 days prior to their due date, they would then arrive on this page. It would have the REDI due date listed for what specific type of benefit they're receiving, whether it's medical or SNAP or TANF. Once they click next on this page, they'd go to another page that would have a review of all the information that would be asked. And then they would go to the next page where they would actually see their individual redetermination paperwork. They'd complete and hit that submit button, and that date and time would be recorded in our system. I did want to point out on the account management tab is a very important communication preferences button. Once the customer clicks on that, they'd come to this page, and from this page, they can choose to receive those notices in paper and electronic or electronic only. This page also allows them to enter an email and a phone number so that they can receive email and text alerts. Those alerts would let them know anytime a new notice had been added to Manage My Case. And of course, that also allows them to receive text messages that we'll be sending over the next year. It also allows them the ability to say, no, I don't want to receive any types of alerts. If we do get a bounce back from an email or a text, we'll start resending paper documents to make sure that a customer receives those. Here's some Manage My Case support we do have for customers at dhs.abe.questions@illinois.gov. We also have a very robust customer support page on the DHS home webpage. It's customer support, and this is a link, application for benefits eligibility. It's got a guide on how to complete an application. It's got a guide on Manage My Case. It's got links to the manual identity proofing forms, and it's also going to have information on our new login process as we move to that down the road in 2023. I did also want to remind providers that they can sign up for provider notices. It allows them to stay informed. They can get notices as they come out. Those are available for application agents as well as any type of provider. One last important thing, we do want to let customers know that there's already scams out there about redeterminations. And we want to give them the opportunity to report those scams. We have a fraud report website, and we have the Medicaid fraud hotline. And we also have direct customer outreach that allows the individual to talk with somebody about that, what fraud they've encountered. And that's the end of the presentation. I'm going to stop sharing and see if we have any time left to answer any questions. I know, again, Lauren's been busily answering questions in the chat.
I'm going to suggest, first of all, Margaret, thank you so much. You covered an incredible amount of territory, and we've learned that this is not our father's HFS. You've done a lot of work to equip us. Thank you to Lauren for answering those questions that are coming through the chat. I wonder if we want to take some questions from the room here that we could feed to you with people who don't have access to the chat, but they can speak them to us, and we'll speak them in.
Sarah recommended maybe going through some of the questions in the chat. And we also have questions that were submitted beforehand that need to get answered.
And then some. Great. We'll try to get all of that. And separately, after the session ends here, we'll also have a little bit more time to continue to talk for those who are in person as well.
So it sounds like we have 3 bundles. Any questions that have come to the chat not answered, questions from this room, and then the advanced questions. And I wonder, so would it make sense to take the fresh questions here and feed those through? And Tamika, you started us out.
I have a lot of questions, but I'm going to start with my main question. For the redetermination, you mentioned Form A and Form B. Form A doesn't require automatic things where you're pulling information from the interfaces in other organizations that have this information, I guess, in regards to income and address and all of that. What things might push someone to Form B? What are you missing? What are you looking for in order to determine automatically if someone is eligible for renewal?
Okay, so if we're able to verify information electronically, that would make them eligible for that Form A. We're also this year expanding the population we're using Form A for to the zero income population. So for individuals that have reported zero income, we will use the Form A ex parte process for that group. If we have a history in our information in our system that shows they have been working, but we've not been able to verify that work information, or our interfaces tell us something different from what the customers reported, we would then go through that Form B process. So there's not really anything the customer can do. It's just a matter of what we find through our interfaces.
There are some employers that report income directly to the state, and that allows that person to be verified. Individuals who have zero income are also commonly able to be verified through the Part A side, or who are receiving, for example, child support payments through the state, things like that.
Yep.
But in other circumstances, less likely, and you can verify their income.
So those
Right.
forms, have you complete those I-9 forms, like they're probably important to.
I don't know if that would for sure be the determining factor.
Okay.
In some cases, it's the size of the employer, rather not.
Mhm. Right.
The thing that goes along with that is, have the income level changed? You mentioned the income levels for qualification for the Medicare patient, the Medicare client, but I didn't see that for the Medicaid. And has that changed based on what's happening with inflation and all of that? Is that the same?
Yes, actually, we can expect a change annually, and we do post that on the DHS and HFS website. When those do go up, they generally go up along with the federal poverty level, which comes out annually based on federal indicators. So generally, yes, that Medicaid levels do go up annually.
Other questions in the room? Yeah. Coverage up until the time that the
I'm sorry to interrupt. We are requesting that the speaker moves closer to the microphone, or the microphone to be moved if audience members are speaking, because the interpreters cannot hear the audio. Thank you.
Ava, we will repeat the question for the
Thank you.
interpreter.
Appreciate it. Thank you.
The question was in regards to whether or not an individual who receives a redetermination letter will continue to have coverage until they respond to the letter. The timing of how long their coverage will continue after they're due for redetermination.
So coverage will.
Oh, wait a second.
1 second, we're clear.
They get the response back. As they qualify to the confirmation as to status.
Can you go over again, Margaret, the timeline and whether or not coverage continues while their case is being evaluated?
Okay, so that redetermination paperwork is sent to the customer the first of the month, in the month that their coverage ends. So 1 month prior to the date the information should be submitted. So they get that information. It's due in about a month after they get it, but we don't cut off until the middle of that month. So it's a little bit of a two-way period that we extend the coverage. If we've not received anything by the end of the month, their coverage would end the first day of the next month.
Oh, hey, Margaret, sorry, can I interrupt for a second?
Sure.
I think
If you've got a better way to express it, Lauren.
I think it might be easier to pull. Can you pull the
Sure.
slide back up? Just want to go through that real quick.
Sure, let me find the correct slide. Here we go.
Yeah.
Okay, yes.
Okay, hi everyone, I'm Lauren. Thanks for all your great questions. So just to be clear here, so let's just use May as an example, since that's our first group. Anyone who has a redetermination due date of June 1st will get their notices around May 1st. We want them to return them by June 1st, but they can return them as long as we have them by June 15th in our system, their coverage will continue. So it will stay open until a caseworker processes that redetermination. So as long as they get that in, and it has to be in our IES system. So that's why the best way to submit it is through Manage My Case, because it just, submits and IES says, okay, I have it. Or if they call, then the caseworker is working in IES. If they mail or fax it, I recommend faxing, because again, it goes to our central scanning. They see that barcode on the form and they scan it. And again, it goes right into IES and IES knows it's been returned. So as long as it's in our system by the 15th, that middle of the month cutoff, the case stays open as long as it takes for a caseworker to process that redetermination. Once the caseworker processes it, the member will get a notice of decision saying this is the outcome of the processing. So they will not get confirmation that we got their redetermination. So we don't send anything that says we got it, you're good. So it's almost like they keep coverage in the absence of any other information, right? So in the absence of us saying the case closed for failure to return your redetermination or for the processing, the case will stay open. Again, so that cutoff is when we need to have the Form Bs in our system. Case stays open. If they don't get it in by their cutoff date, their case will close as of the end of the month because of failure to return.
APIS case.
It's not because it's not eligible, it's because they didn't return their form.
That they first enrolled.
If that's the case, we want them to then submit the form, even though it's late, during that reinstatement period.
That's what I sound like.
Because then their eligibility will go back to the date that they lost coverage. So their eligibility will go back. And so, they won't have had coverage, but if they have outstanding bills during that, kind of reinstatement period, they can have the providers submit those bills to HFS. So it's better to submit a late redetermination than to submit a new application. So we don't want a new application if they're still in that in that 90-day reinstatement period. Hope that helps.
Shall we try a switch?
Yeah, let's, we're gonna try to switch computers because I have an internal internet thing. Do you maybe wanna ask your question while we do this?
We're having some connection difficulties. We're going to try a different hotspot. Give us a
Okay.
couple of minutes to switch.
Just be able to pull that up, plug it in, right?
Did I see in the chat, Kara, that they asked about, how do you get confirmation that they received your information? Like, if you call in or.
They don't.
So there is confirmation if It is returned through Manage My Case. Manage My Case will give confirmation of the date and time that it was submitted.
Right.
Otherwise, the customer would not get a confirmation.
Yeah, or, so that's why if they're faxing, which I think is better than mail, because they can keep that fax confirmation
Right. Yeah.
that it was faxed. So do not send anything to a local office. If like everything now has been centralized, we have our central scanning unit. So that any mail on the address that's on the form goes to central scanning. The faxes go to central scanning. So that takes away the variability of caseworker action. I just saw there was a chat. So we don't want to involve individual caseworkers. We've centralized our systems, and that's why Manage My Case is the best option: phone and then fax. Those would be my 3 priorities to
Yeah.
recommend.
And why going to the office would probably be the least desirable, because there's just too many variables to account for when you're going to the local office.
Right, and it means they have to then do work to get it into the system on time. And so again, we want to use the centralized systems that have been set up for these reasons.
Okay, we have another question here in the room. Yeah.
So the first one, if we know, does the redetermination application look different than the initial application?
If they help folks reapply or redetermine online, does that look different than the original application?
The Rede and Manage My Case, assisters or application agents will actually be sitting with the customer and going through Manage My Case with them. The same questions will be asked through Manage My Case as questions asked on the paper documents. So it's just a matter of the way that it's submitted.
Okay, a follow up to that.
And they were submit the application, but they don't have the documents just yet. They need a day or two. Can they drop off the documents, or can they fax them later?
If they don't have the documents with them while they are applying or redetermining online, how do they get the documents? Are you talking about like Manage My Case online? Is that okay? Yeah.
So if they don't have documents to upload, I mean, there is the potential to upload those documents through their computer. If they're proof documents that are requested, they will then get a letter or a notice through Manage My Case telling them what proof is needed. And that then they'll have, I believe, a 2-week period during which they have to return that proof. They can fax that proof in, they can upload it through Manage My Case, or there'll be an address on the notice that is sent to the house telling them where they can send the information. But again, it can be sent through fax, it can be mailed, or it can be uploaded through Manage My Case.
Oh, sorry, can I just follow up real quick? But the most important thing is to get the form in, not to have it. So if they don't have the documents, submit the form anyway, because
Yep.
again, we have attestation, we're taking attestation, we're asking to submit proof to try to avoid or a later verification checklist. But the most important thing is to complete the form entirely, answer all the questions, sign and submit. That's the most important thing.
Awesome.
And then
All
we
right,
can submit forms later. Yeah.
awesome. No, we have a question here and then there. Yep.
To be submitted, like
Is there standard documentation for redetermination that we can prepare families with?
The most commonly required is that 30 days of income, if we've not been able to verify it. And I did see somebody asked about self-employment. Self-employment will always get that Form B, and they will need to submit proof of income through self-employment as well as expenses, because we will take into account expenses.
One more question here. During redetermination, will somebody have the opportunity to change their MCO?
No, the two processes are completely different. So this is eligibility. Managed care enrollment is based on a separate time period. And so they will have to check on their open enrollment period in order to change, to know when to change enrollment. But it's really important to understand the processes are very different and separate. I mean, they're obviously tied, but they're separate. So I know some people get confused because they might get something from their managed care organization that makes them think they still have coverage when, you know, they've missed their, or they have sort of a pending redetermination form. And that's just a timing issue. So eligibility, you know, drives enrollment in managed care. So, but it's a separate timing, but it's really important to keep those two time periods separate.
Could one of you talk a little bit about what happens if folks don't have their address updated and haven't signed up for like text messages or emails? I know that's a big concern here in West Chicago, as people have moved 3 or 4 times. What happens if the address is wrong?
So those forms will get returned to us. If there's an updated address on the returned mail, we will send back out to the updated address on the returned mail. Aside from that, we really are looking to the customer to try and make sure that we have the correct address. But again, if we do get a return with a forwarding address, we'll send back out to that address listed.
And could you share one more time, especially for folks who aren't signed up for Manage My Care, how they update that address?
We have 3 different ways the address can be, well, Manage My Case is one of them, but also we have a phone line where you can update your address, and we have an online form where you can update your address. Let me share the screen.
Great, thank you, Margaret.
Oh.
Yep.
It's just really important. Yeah.
Let's see.
Awesome. Are there any more questions in the room? Got a whole bunch in the chat. We'll make, yeah.
Oh, sorry, Margaret, I'll take this. Margaret, I'll do this while you're answering. Margaret, I'll do this.
Okay, thanks. Okay, next question.
How do you become a Get Covered navigator?
So Get Covered has their own process through which they train their navigators. We also have HFS application agents directly through HFS, and we do have an application agent page right on the HFS website. It is right below the provider. So if they click on providers, they'll be the first tab will list that application agent page. And once you click on that, you'll be brought to a page that'll take you through the process of how to become an application agent.
Oh, just real quickly, so just to go back to this is medicaid.illinois.gov that I typed in here. So here's our main landing page, and here is our ready to renew messaging toolkit, which Margaret talked about. I wanted to just show you all the different languages that we have here on the right. So everything has been translated for you, and you can just, you know, co-brand it. And then we also have our here's our report Medicaid change of address form. So someone can submit the form online, or they can call the Bureau of All Kids to change their address. So strongly recommend you get familiar with this. And we also will have our frequently asked questions uploaded on this here. We have FAQs uploaded here as well. So just
Awesome.
keep going to that page.
That's great. Thanks, Lauren. The visual, I think, is helpful. We don't want change of address to be the reason people lose their insurance.
Yeah, definitely.
Okay, I think that's all the questions in the room. There was a question about if we can get the chat history, so you can see all those questions and answers that have been in the chat, and we can definitely do that as well, because there's been lots of good info there. Is there anything else that yes, Dave has a thought.
So we could invite Rosa to share questions from the chat that have been unanswered. Would you step up, Rosa?
Yeah, of course. So there's some questions on here. The first one is from Kate Peterson, from Senator Villa's office. How do you suggest helping customers create an MMC account who do not have their own devices? Are publicly used computers, such as from libraries, able to be used?
Yes, definitely. Public libraries, and we do know that some assisters will come out and meet somebody at a public library for assistance. I would also, again, refer to that Get Covered Illinois Navigators, as well as those HFS application agents as a source of assistance.
Okay. The next question is from Min Win. With regards to MMC, I've seen many clients whose MMC accounts are active but not properly updated by the state. Some show no correspondence despite receiving letters in the mail.
So I do know that it has not been updated for some people during the PHE period. That will continue to be updated as they get closer to their redetermination date. But if they are close to their redetermination date and things are not updating, please let us know so that we can look into that.
Okay, another question from Snitco AN17. How about if customers are self-employed and they have only medical benefits? Will those customers receive Part A or Part B renewal forms?
Definitely Part B, the Form B for anyone that's self-employed, because we do need the statement of income and costs.
Question from Bernice H. Customers that have immigrant Medicaid, will they also receive redetermination notices?
They will.
Okay. Melanie Pittman asks, is there a specific number or email that the client can send directly to their caseworker, especially if they do not have Manage My Case nor have the internet?
So I was going to say Manage My Case does offer the option to send an email to the office. Aside from that, each office does have a phone number. So you can use the DHS site that has a office locator to locate specific offices and phone numbers for specific offices. But
Okay.
There is no email option unless you're using Manage My Case.
Will every Medicaid client have to reapply? Please explain Form B.
So again, around 50% will get that Form A, so they won't have to do anything unless the information has changed. Those that get Form B will need to complete those and send those in, either faxing. Again, redeterminations can also be done over the phone, which is a great option for those that don't have access to computers and maybe may have difficulty completing the form, or they would fax in or send in to that central scanning unit.
Okay. Somebody's asking for a form for people who only get SS income. Is there a form specifically for that?
So I would say for most people that only have federal income or Social Security, we can generally verify that information through our interface with Social Security. So it's pretty likely they would get a Form A. I'm not going to say 100% certainty they would get the Form A, but most likely. And again, we do have an interface with Social Security. So we would be able to verify that information electronically.
Okay. One last question. If we fill out a paper version of application or redetermination, sometimes there is no button to renew the benefits on ABE, just paper version. If we cannot access through machine or email, can we upload that paper version of redetermination and supporting docs to ABE instead of faxing or emailing it?
You could upload it through Manage My Case, but
Right. Yeah, I answered that one. It won't automatically, if you upload it and Manage My Case and it's not like responding to a specific request, like there's a verification checklist. If you respond to that and upload something, it will go right into the system. But if you're just uploading a random document, it would create a task for a caseworker, and the caseworker would have to do it. So I recommend calling the DHS call center and redetermining on the phone. If anyone has these challenges, it's just the best way. I know they may have to stay on the phone. We don't know what the call wait times will be, but DHS, has been working on this for a while. They're updating their phone system, but I would strongly recommend just calling if you can't use Manage My Case or there's no like fax available. Just call that number, try to call it in the, early in the day. Mondays and Fridays and lunchtime tend to be, in the past, the longer wait times. Just, especially if it's down to the wire, if it's like coming up on the middle of the month and they haven't submitted, it's going to be worth it to stay on the phone and submit it.
Yeah.
Looks like that's it from the chat.
I will add that additional staff have been hired to account for the increased needs of the phone line. So we do have additional staff.
Right, and the other change they've made is they have now centralized the phone system. So if someone calls a local office, it will likely go to a centralized phone system that it won't go to the office specifically. So no one will be able to ask for a caseworker or anything. It will go into a centralized phone system, which is good because they can add more people as the wait times increase to keep it down.
All right, thank you, ladies. I know there are a million questions, but now everybody's clear as mud as to what we need to do. I asked Kara. Oh, I was gonna say Kara's gonna talk just a little bit about some DuPage resources, and then we'll cut the Zoom people loose and kind of continue some debrief in the room. But we just wanted, since everybody on the call is from DuPage, we wanted them to hear from Kara as to kind of what some local resources are.
Great. Hi, everybody. Kara Murphy with the DuPage Health Coalition. As I shared earlier, we coordinate healthcare for low-income, uninsured, and underinsured residents here in DuPage County. And we do have some specific programs here that aren't necessarily available in other communities. So I wanted to make certain that people were aware. I'm going to put my email address as well as the website for Access DuPage in the chat in just a moment. And you can certainly feel free to reach out to me directly. But in the meantime, through this redetermination process, if individuals, because their income has changed, because they have aged into or out of eligibility for certain programs, because they had coverage due to the birth of a child, and that period of eligibility has now ended, any of those individuals who are falling out of coverage for Medicaid I would encourage you to refer them to our office so that we can screen them for eligibility for a host of different programs. One of the programs that's available is a program called Access DuPage. We've been around for about 21 years here in DuPage County. And if individuals have income at or below 250% of federal poverty, if they live here in DuPage County on a permanent basis, regardless of their immigration status, and if they don't qualify for Medicaid or an ACA marketplace plan, then those are individuals we are able to enroll in Access DuPage. Through Access DuPage, they're able to access low-cost primary care, coordinated pro bono specialty care, medication access with small co-payments, and access to hospital-based services when their primary care or specialty care providers recommend that. So it mirrors in a lot of ways the benefits typically available through insurance, but it is not insurance. It's a program intended to support individuals who can't qualify for insurance. The other program that we have available is a program called Silver Access. Silver Access is helpful for individuals who might be losing Medicaid because their income is too high or because their status has changed, but who still qualify for an ACA marketplace plan. An ACA marketplace plan with a subsidy is available to many of the folks who might lose eligibility for Medicaid, and Silver Access will significantly subsidize the cost of that new plan for which they qualify, allowing them to purchase a higher quality plan where we will typically, and it's based on their income, there's a sliding fee scale. Again, it goes up to 250% of federal poverty. But in most cases, members will pay either 1, 2, or 3 months of the cost of their ACA marketplace plan, and the DuPage Health Coalition will pay the remainder. All of the carriers on the ACA marketplace, except Molina, are currently participating with us. So there are 7 carriers, 6 of the 7, including Blue Cross and Cigna and Ambetter, the plans that have the greatest number of participants, are accepting payment from us. And all of that information is available on our website, but I will also put both our website, our direct phone number, and my email address in the chat. Effectively, if you find someone who is losing coverage, and it's not because they didn't get the letter, but rather because when they submitted documents or were analyzed through Part A, they were found not to qualify, Form A, excuse me, then those folks should be referred to us, and we would be more than happy to help them. I don't know if Robin Lavender is on the call. I know that I saw her enrolled, but if she is, it might also be helpful to talk a little bit about the health department resources available to help people both with redetermination and with enrollment. I don't hear Robin, so I'm going to speak on her behalf and say that the health department has a host of excellent and highly qualified navigators that are available to assist people if they're struggling with the redetermination process, or if they need to apply for new coverage for either the marketplace or the ACA, or if they need to apply for either Access DuPage or Silver Access. So you can call the main number of the health department, and those appointments can be coordinated either in person at one of the locations of the health department, or in some cases may be able to be completed by telephone. My office also has a host of navigators. We have 5 navigators helping people to apply for the marketplace or for Medicaid. We're primarily focused right now on helping people to enroll in health benefits for immigrant adults, because we have Access DuPage members that are transitioning into that coverage. But if you're having a difficult time connecting someone to a navigator, would also encourage you to have them call us, and we'll see if we can't help them out as well. I think that's everything that I wanted to share. Like I said, I will put my information in the chat right now.
Awesome. Thank you so much for joining us, everybody. We are going to put this PowerPoint and the recorded presentation and the chat and other resources, FAQs, flyers. We're going to put that all in a good email bundle and try to get that out to you by maybe the end of the week, for sure, early next, so that you can keep helping your families and clients. So with that, we'll end our Zoom portion of today. Thanks again for joining us on behalf of We Go Together for Kids and the DuPage Federation and the DuPage Health Coalition. Thanks for being here and for caring for your families.
Have a great day, all. Leave meeting?